So why surgery? Because it works, okay? So obesity is a problem that's affecting a lot of developed countries such as the United States, okay? It's not just about being bigger, it's about all the other health problems that come with obesity. Those problems include diabetes, high blood pressure, high cholesterol, gastric reflux disease, sleep apnea, arthritis, and as we're discovering lately, an increased risk of certain cancers. Okay, all these diseases are associated with being overweight. All right, so the point of getting the operation done is not only to lose weight, but also help you get rid of these other problems and then prevent them as well. Obesity is the second leading cause of preventable death. Okay, being overweight increases your chance of dying younger. It's a fact. And as I said, surgery can help make sure you live a full, healthy life. It can also help you with other medical problems and a lot of times cure them. As I said, cancers, we're starting to find, you'll see it on CNN, you'll see it in Time magazine, we're starting to find that people are getting certain cancers younger and more often. And the reason why is because being obese increases your risk for certain cancers. Those include brain cancers, cancers of the esophagus, cancers of the blood, kidney, uterus, ovaries, breast, liver, gallbladder, etc. Okay? I know there's a recent article in CNN where it said that people, in their 30s and 40s are now getting colorectal cancer more often. And the association is with obesity. As younger people get bigger, they tend to get cancer earlier. All right. Surgery is not just limited to your physical health. It can help you with your mental health. If obesity is something that causes you to have anxiety in social situations, it's something that causes you to, be down about yourself, self-esteem, depression, etc., losing that weight may help you with that as well. Okay? People, as I said, one of the quotes before, people often say they feel younger than they have in many, many years. Okay? We obviously need to make them younger, but physically with the weight loss, they feel healthier, more energetic, etc. I know every time you turn on the television, every time you go to the grocery store, every magazine is always the latest, diets, pills, exercise programs, etc. All right. Unfortunately, while those may work in the short term for weight loss, the only proven long term, I'm meaning years, not just a couple months, but years, decades, for most proven way to lose weight and keep it off is an operation at this time. You'll lose weight fast. Most people lose most of their weight within the first year. Okay, you will lose weight. It kind of forces you to. All right. You lose lots of weight. I'll talk more specifically later, but most people lose about a third of their weight. Okay, so if you weigh 240 pounds, you're going to lose 80 pounds. All right, probably have never lost that on a diet, and if you have, I doubt you kept it off for very long. And again, it keeps the weight off for a long time, and we know this as we've been studying these operations. The bypass for about 50 years and the sleeve for about the last 15 to 20 years. And we know that people that had it back then still have kept their weight off. So there's some numbers for you. Diet and exercise, medications, scientists, PhDs, MDs, we do lots of research into losing weight. What we've shown that the majority of people will only probably lose about 10% of their weight closely following a diet or doing extensive exercise. Okay, and that's in 1 year. Not everyone loses weight even doing a diet and exercise. I'm sure many of you have found that with your own experience. That's likely why you're here, is you found both diet and exercise, no matter how hard you exercise or how strict you adhere to a diet, you either don't lose much weight, you lose it and gain it back. So what is surgery compared to those? 33% at 1 year. Everyone loses weight. We're finding that even 15 years out, you will regain a little bit of a weight, but you still have 25% less than you started with. And that's probably a pretty good number. It's a lot better than 10% at 1 year, and usually you gain that back anyways. All right, so the data shows that weight loss surgery is the most effective way to keep weight off. Studies have demonstrated decreased death rates or early mortality, 25%. It decreases high blood pressure by 80%, diabetes 60 to 90%. That includes coming off insulin in a lot of cases. Sleep apnea, that includes coming off, obviously, the CPAP. Heart disease, diabetes again, and cancer. All right? So surgery is not just to make you skinnier, it's also to help you become a healthier individual. You know, again, acid reflux, asthma, arthritis, cholesterol, all these things, you know, surgery helps you improve those. You know, here is a picture basically of everything that being obese can lead to, other diseases. Again, you know, increased migraines, depression, high blood pressure, liver disease, which is a big one. You know, people don't realize it, but being overweight, you're actually set up for cirrhosis. Okay, if you go to a liver transplant unit, not everyone there is an alcoholic or a patient with hepatitis. There's a lot of people that never drank, never had hepatitis, they're just overweight, and their liver was overwhelmed by the storage of fat in it. Okay, and they're on the liver transplant list. All right. It's actually the fastest rising incidence of liver transplant is from being overweight. So again, the diabetes is a big one because probably I think the disease that most people fear from being overweight is having diabetes. You get put on insulin, and then you have problems like neuropathy, you know, wound infections, etc. You know, both the International Diabetes Federation and the American Diabetic Association, along with the Heart Association and Obesity Society, they recommend weight loss surgery for people with a body mass index, which I'll get into in a little bit, over 35 because it helps with diabetes, it helps with heart disease. Okay? These are medical organizations. These are people that prescribe medicines. They're saying that we have essentially the best answer for people that meet the criteria for weight loss surgery.